Good evening. Singapore has confirmed a total of 6 additional cases of novel coronavirus infection, of which a cluster of 4 had no recent travel history to China and are therefore a result of local transmission. There is, however, no evidence of widespread sustained community transmission currently. 3 of the local transmission cases can be traced to contact with recent travelers from mainland China. The 4th case is a close contact of one of the local transmission cases. The Ministry of Health has commenced contact tracing to identify individuals who had close contact with these cases so as to ring-fence the cluster and limit further spread. As I mentioned yesterday, the cases of limited community transmission are not unexpected. This is a scenario that we have prepared for and we are ready to manage it. We have earlier built in multiple lines of defense to reduce the risk of imported cases and local community transmission. These include border controls and quarantine and leave of absence for those who are deemed to be at risk. These efforts will continue to help reduce the risk of escalation. But as the situation evolves, we will step up our posture accordingly. To further contain transmission in Singapore, we will enhance environmental cleaning and encourage increased frequencies of cleaning for high-traffic premises, such as food and beverage outlets, retail shops, and hotels. We are extra cautious when it comes to the vulnerable groups, such as our children and the elderly. Our schools will be adopting measures to avoid large gatherings. Our elder care facilities will also suspend external excursions and large-scale gatherings. As an added precautionary measure, we are also contacting individuals with similar profiles who have had recent close contact with travelers from China. If they are unwell, they will be assessed at the hospitals and quarantined if necessary. But these efforts alone will not work on their own. Most importantly, every Singaporean must play our part in adopting good hygiene practices. We should regularly wash our hands with soap and water and avoid touching our face. This is the most effective way to protect ourselves and our loved ones. As I pointed out yesterday, despite our best efforts, Singapore could still see extensive community spread. At that point, we will need to consider measures to reduce human-to-human interaction, such as cancelling mass gatherings, suspending schools, paring down non-essential care services, and introducing further infection control and monitoring measures to slow the spread. We are closely monitoring the situation and stand ready to ramp up our measures if necessary. I urge Singaporeans to remain calm. We will spare no effort to protect our people. Let us work together to contain the spread of the virus and to keep one another safe. Thank you. Let me just say a few words in Mandarin. 新加坡证实出现了首4起在本地社区传播和感染的新冠状病毒病例，他们并没有在近期到过中国，但是目前没有迹象显示病毒持续在我们的社区里扩散。经过追踪调查，其中3起本地的病例都与一团从中国来的游客有过密切的接触。第4起是其中的1起也有密切的接触。卫生部已经展开追踪调查，找出曾与这些病例有过密切接触的人，尽可能隔绝集体发病的病例，以降低病毒进一步传播的危险。病毒在社区里有限度的传播，并非意料之外的事，这是一个政府已经预料，也已经做好准备去应对的情况。我们之前已经设下多层的防卫，降低病毒输入我国以及在本地社区传播的危险。但随着局势的演变，我们必须根据情况做出调整。为了加强压制病毒的传播，我们将采取一些行动。第一，加强环境卫生的清洁工作， 并鼓励人们更勤劳地打扫一些人们常去的地方。第二，对于儿童跟那些弱势群体，我们会加倍的留意。本地的学府将采取一些措施，避免有多人聚集的情况。我们的护老设施也会进行同样的措施。另外，我们将联络那一些最近到过中国和的旅客有过密切接触的人，如果他们身体不适，医院会为他们做评估，如果有必要，也会隔离他们。但是单靠这些措施是不足够的，因为最重要的还是每个国人要采取良好的个人卫生习惯。我们应该经常用肥皂和水洗手，而且要避免用手触摸自己的脸。这是不单只是保护我们自己，也保护我们的至亲，这也是最有效的方法。即使我们尽最大的努力，我国还是有可能会出现病毒在社区里扩散的这个情况。如果到了那个阶段，我们就有必要考虑采取更重要的措施，降低人们之间的互动和交往，例如取消一些大型的聚会，学校暂时停课，减少不必要的医疗护理服务，以及制定疫情管控和监控措施，来压制疫情的蔓延。我们目前正在密切地注意局势的发展，也做好准备，在必要时加强应对的措施。我呼吁我们国人要保持冷静，政府将竭尽所能保卫国人的安全。我们同心协力，压制病毒的传播，能够保护彼此的安全。谢谢大家。Now we can open the floor for questions.
Yang from Chinese Media Group News. How big is the group from China, Guangxi? From which day to which day were they in Singapore? For the Chinese medical hall that they visited, how frequent or how long was the stay there? What did they do at the medical hall? Were there any other staff from the medical hall that are now suspect cases? Thank you.
I think many of these are in the process. We are in the process of investigation and following up on contact tracing, because these cases, as I mentioned, were discovered recently, and we try to announce and share the information as soon as we have the information. And I think my DMS will be able to explain or elaborate a little bit more on the details of some of this contact tracing progress, including the tour group that has been in Singapore. We will ask my DMS to elaborate.
Yes, indeed, Minister. Contact tracing continues. Right now, the information that we have continues to come in, and we therefore will not be able to answer all the questions you've specifically posed. Basically, in contact tracing, we interview the confirmed case, the person who is actually confirmed to have this infection, in order to find out what his or her movements are. In fact, sometimes we will even verify those movements by using other sources of data, including sometimes phone records, travel records, and so on. And then we map out who exactly that individual has been in contact with. That includes the people that he or she has interacted with, worked with, met with, and then subsequently contact tracing then starts to contact these individuals to find out whether they are well, whether they have any symptoms at all, and also to verify their contact details in case we need to come back to them. This is a laborious process, and sometimes will take days, if not even weeks sometimes. It's done faithfully for every single case that we have. That process has started for these new cases and continues at this time.
Perhaps I should also add that the tour group that I was referring to has returned to China. And these contacts were actually a result of our checking with the Chinese authority, and some of the details are still pending confirmation with the Chinese authority, and therefore some of the details we will not be able to share until the confirmation has come in. Sama?
Was it a coincidence that all 4 from that cluster went to hospitals on the same day yesterday? Because the incubation period is different. And then a follow-up question, the tour group would not have spent too long in the shop, would it? So is that enough to spread it to 2 people? I mean, is that something new?
I can ask my DMS to elaborate, but my understanding is that if you remember what I said yesterday, the mode of transmission is not necessarily through casual contacts, because these tour group members of these tour groups were in the shop and making purchases. They have interaction, so I think they were very close contact with the shopkeepers. And that is one of the reasons why we suspect that the transmission happened. But as in such cases, it is very difficult to pinpoint exactly the route of transmission, but there were circumstances that I think provides the opportunity for very close interaction between the shopkeepers and members of the tour group. So therefore, it is possible for the transmission to happen at the environment. And you had another, the question of whether it's a coincidence.
Why all four
Yes.
went at the same time? And then the close transmission would be for a very short period, whereas your definition is 30 minutes within 2 meters?
Yes. These 4 contacts were not all at the shops. And it so happened that there are cases surfaced within a short period of time. That's why we are announcing them today. So I think the confirmation came more or less at the same time. So the infection might not have occurred all at the same time because the environment and the nature of the close contact were quite different.
No, but they all presented at the hospital yesterday. So,
Yes.
why all 4 yesterday?
Some were results of contact tracing. Some were results of enhanced surveillance in the hospitals. So the circumstances are quite different. It just, in a way, it's just coincidental that some of them happened at the same time. Some of them do come together because it was part of the contact tracing that we follow up immediately. I think we did give you the timeline, did we, in the press release?
Yes.
Yeah, we gave you a timeline when they reported to the hospital and when the tests were confirmed. Yeah. So it happened only yesterday, and therefore you have to bear with us that there's very limited information that we have yet, because we try to share with you as soon as we got the information. And therefore, a lot of the details we are still investigating and following up with the contact tracing. And as and when we have more information, we will share with you. This is also the practice that we have done in the past press releases. Sometimes we give you an advance notice that we have a case, but details were not available yet. But in subsequent press releases, we will always share with you information that we have. Maybe this.
John Getty from Reuters. Just a couple of questions. Have you got any update for us in terms of the number of suspect cases that you're currently looking at the moment in Singapore? And secondly, in terms of the test that you do for the virus, I believe this is a blood test. How long does it typically take to get a result from that test to know if someone's positive or not?
I don't have information about the number of suspect cases at hand at this time. Certainly, that information we can update with more information. But that number changes over time as we perform contact tracing and when we pick up individuals who may have symptoms that fit our case definition. And we do have a somewhat low threshold for tagging people as suspect cases. That number will continue to change. In terms of the test that we do, we in fact carry out the blood test. It's a PCR test, or polymerase chain reaction. It's very similar to the tests that in fact are done in many other hospitals in many other countries to diagnose the presence of the virus in the bloodstream and therefore to diagnose an infection. Typically, a run for this test may take several hours, sometimes between 2 and 4 hours, but there's often sometimes a need to verify results to make sure that in fact the results are correct, and therefore sometimes that process may extend all the way through to even up to 24 hours. But typically a run with a good specimen may take just a few hours.
And if you need the number for suspect cases, we can get it for you. It's just a number that changes all the time because as we also discharge suspect cases when they are confirmed negative. In fact, it's not confirmed. They are tested negative, so we release them, so they are no longer suspect cases. But at any time, there are also new suspect cases that came in. So it's a dynamic number. So we can give you the number as of whatever timeline that we have after the press conference.
Okay, so we are saying that there is local transmission but no community spread. Could you just explain what is the exact difference for us, especially given that the foreign domestic worker was not in the shop and yet she still got it? Also, could we check what is the DORSCON level still at yellow given that there is local transmission?
Yes. There is limited community spread in the community transmission. The idea is that there is a contact source of the infection that is not imported. So there is a secondary transmission from one of the infected person to a local. So both are locals. So this is therefore a limited community spread, but it is not a widespread community transmission. And the main difference is that for this particular cluster, we are able to identify all the contacts that are involved, including the source of the infection. As I mentioned, they were involved, they were in contact with a group of Chinese tourists from mainland China. And this particular group of mainland China tourists, we were able to have their names, and we have indication of who were the individual patients that fell ill and were confirmed as a positive case for this novel coronavirus. And therefore, we are able to identify the specific source of the infection. Now there is a local transmission, and there's a limited transmission, and if we are able to ring-fence this particular cluster, then we will be able to control the infection spread. So therefore, we say that this is a limited local transmission. But when you have cases popping up in different parts of Singapore, different clusters occurring, and you may not be able to determine the source of these clusters. You can have a few cases where you have no idea where these cases come from. They do not have a specific source. Then you have a widespread transmission. And when that happens, then we will have to move to a DORSCON orange. So today we are still at DORSCON yellow, but we're watching the situation very carefully, monitoring the developments, and we may adjust as we go along. As I mentioned earlier in my press statement, that we are monitoring and we are quite prepared to adjust our posture and our stance as and when we see the development happening around us.
We treat these cases very seriously. You may remember that in the previous statements, we had shared with you information about previous diagnosed cases, and all previous diagnosed cases had a travel history from China, specifically from Hubei province. So today we are reporting to you the first case, or first two cases, where in fact, first three cases where there is in fact no actual travel history. However, as we carry out contact tracing, we believe there is still a link with travelers from China. So it's not a case where these are people getting this infection, coming out, and we have no ability to even find any plausible link or any plausible reason why they should be getting this other than spread from someone in the community. So from this perspective, we still believe that there's some link with travelers that have come from China. One of the cases, in fact, is the domestic assistant of one of the other cases. And from that perspective, there may have been an element of local transmission in a very closed, controlled setting within the home, and therefore that has occurred as well. It's early days yet. We're still continuing to do contact tracing, and we continue to be vigilant for more cases. There may be more cases that come out in relation to the same exposure to travelers from this particular travel group, but that may emerge over the next few days. So we continue to be vigilant, to be on our guard, to determine whether, in fact, more cases will come up. At this time, we still don't see other cases not linked to any travel from China, and that's why we are saying that at this stage, we don't see that evidence of a free community spread.
Just to clarify, let's say if you have a cluster and you know who was the first patient in that cluster, but you have no clue where this patient got his infection from, then you have a bigger problem, because then you have to figure out that we need to have a strengthened community measures to prevent the person who causes the infection of this cluster, because we are not able to identify who he or she is. Then we need to therefore enhance the protection in the community. But now, for this particular cluster, we are able to establish that the source is from a group of tourists from China, and this tourist has now returned to China, and therefore we are able to contain. If we are able to ring-fence this particular group, then we will be able to then manage this particular cluster.
Hi, Junsen from Today. Just wanted to ask, based on preliminary information, whether the transmission was done in an asymptomatic phase, whether the travelers who had spread this had any signs or symptoms based on what you know so far. And I also wanted to ask about the shop itself, what is being done to the business, how large is the number of employees, and what is being done to cleanse the area.
The travelers have all returned to China. We don't have an ability at this point in time to interview them directly. The tour guide, who in fact led this particular group of travelers, did report that several of these travelers, in fact, were coughing and sneezing while they were in Singapore. So it could very well be that this is a possible mode for transmission. But because we don't have any other information, this is speculative. We hope, therefore, with further information, we could be a little bit more definitive in sharing what the possible mode of transmission is.
The shop, we don't have the details at hand at the moment, I suppose.
Yes, but it's routine that, in fact, when we have a premise where we know imported cases occur, we collaborate and partner with our other agencies, including MEWA, and they do, in fact, go down to the site at hand, and they often will do an inspection, if necessary, also carry out cleaning. I should point out that, in fact, if we're dealing with this particular shop based on this particular exposure, this, in fact, is quite some time ago. This group, in fact, has returned already. And if we are talking in terms of perhaps of coughing, sneezing, surfaces being contaminated, by right, the virus doesn't last that long. So from that point of view, there may not be any further ongoing threat, environmental threat, as far as the shop is concerned. Nonetheless, I understand that our partnering government agencies, in fact, will have a look and inspect the shop and assess further.
So it's still open for business?
I don't have information on that, yeah.
Hi, Haziq from CNA Digital. Just regarding three questions. Regarding case 19, she went to the hospital actually for pneumonia and was discharged. When the test came back negative, perhaps are there any lessons to be learned from that, because she went back and then she had pneumonia? My second question regarding the cases 22 and 23, they were on the Scoot flight back after being evacuated. Do you have their age and gender? And for case 24, for the foreign domestic worker, you mentioned that it was transmission the one about the tour guide. Do we have any info on her movement and all that? Because
we'll start with case 19. You've given us a few questions, so I'll probably have to take that one at a go. Case 19 had presented to Tan Tock Seng Hospital before. At that time, she was assessed and not found to have any signs of pneumonia. She has no travel history. In fact, from that point of view, she did not meet our case definition based on the information that we had about this evolving illness. And therefore, in fact, she was not admitted to hospital then. The situation had changed by the time she actually presented to the Singapore General Hospital. And this time round, she actually had pneumonia and was subsequently admitted for treatment of a pneumonia. We have expanded our precautionary measures of surveying patients. And in fact, over the last week, we've in fact also been testing patients with pneumonia to assess whether or not any of these patients would also have signs of this infection. And in that context, she was also tested, and she was tested positive. You asked a question about case 21, is that right?
22 and 23.
22 and 23. 22 and 23 were residents that were part of Singapore residents that were part of the evacuation flight from Wuhan. I don't have further information at hand, but certainly further information can be shared to you subsequently.
And the movement for case 24?
Again, contact tracing is in progress, and therefore we will not be able to give you further information just yet. But as information is available, we may make that available also through further press statements.
Jing He from Zhao Bao and Wan Bao. Just wanted to check, right, for the 3 cases who were in contact with the Chinese travelers, it says here prolonged interactions. Can you give us like a more specific description. What is a prolonged interaction?
Let me perhaps put in context. One of them is a tour guide. And tour guide, of course, you are with a tour group for a long period of time. And the other two were working in the shop, and therefore they would have interacted with the tourists, members of the tourists, of the tour group, and it could have been one of the cases which were confirmed positive when they went back to China. So that interaction is going to be a customer and a shop shop employee interaction. You will be talking about purchasing things. So it's not a transient contact that you just pass by in a lift or you just happen to meet him on the streets. So there is a contact between them, and there's an extended time which they have interaction with one another. So that's in that context that we say that there is a prolonged interaction.
So in that sense, by talking with someone who potentially has the virus, can lead to transmission?
It is difficult to determine at this point, as I tried to explain, that the route of transmission is cannot be very specific, because this it's very difficult to investigate exactly how it transmits. I could give you an example. Just one of the examples is not necessarily the route that is taken. Say, for example, the person who is ill might have been in contact with some of the merchandise that he's buying. And the merchandise could have been contaminated, just the tables and chairs, which I explained in the Parliament. And the salesperson who have handled the material after that, and if he or she touches the face and eyes and nose, she would have gotten it. So it's not necessarily through talking or sneezing, or that's one possible route, but through touching and contact surfaces is also possible. So given that this group of tourists has spent some time in the shop doing purchases and so on, there will be this kind of a physical interaction with the employees of the shop. Then therefore there's a possibility that transmission could take place in different modes. Sama.
Thank you. You know the 4 cases of Singaporeans returning from Wuhan. Are there any links between them? Are they family? Are they together, etc.? Or are they 4 separate entities? That's one question. The second one is, you're checking all pneumonia cases in public hospitals. Pneumonia is the 3rd largest killer in Singapore, so there are a lot of cases. How many are we talking about, and how many can you actually test per day?
We don't have any information about whether or not the 4 who returned from Wuhan and are currently admitted in hospital are related in any way. So that we don't have the information. Certainly, we will look into that to explore whether there are any physical relationships that the 4 have. The second question you asked was in relation to...
The pneumonia cases you are testing.
Yes.
How many cases?
That's right. These are patients who are already admitted in hospitals for pneumonia. I don't have an exact figure, but I will not be surprised if we may have somewhere in the order of 500-600 such patients in a week that actually presents with an acute respiratory illness and a final diagnosis of a pneumonia being made. We don't think that the testing capacity is going to be an issue. We, in fact, have sufficient capacity to test these individuals, including those that come on as suspected cases further downstream as well. But it's an ongoing process, and therefore it's not something that we can complete immediately over one few days. And as new cases come, these new cases will also in turn be tested.
Behind.
Catherine from AFP. Can you please tell us specifically what drugs and treatments are being used to treat infected patients in Singapore and how effective they are?
At this point, maybe I'll ask Professor Tan Chow Chuan to talk a little bit about the treatment. As I mentioned, currently there is no drug yet, but there's a significant effort in developing a treatment protocol. So maybe Chow Chuan can talk a little bit about the research work that is going into this development of the treatment drugs.
So many of the patients actually are not that ill, and therefore they are on supportive treatment. A small number are on an antiretroviral combination, lopinavir, ritonavir, which has been used and appears quite promising. Clinical trials actually started on this in Wuhan, and the results should be out, we hope, in the weeks ahead. But for the moment, that's the therapy that some of them are receiving. Yes, they are.
Yes.
Hi, I'm Zhipeng from Chinese Media Group News Hub. 2 questions. The first one, for cases 22 and 23, it stated that the 2 cases tested positive on 3rd February. I'm referring to the 2 Singapore residents who were evacuated from Wuhan. Yep, so they were tested positive on 3rd February despite continuing to show no symptoms. So may we know that is contact tracing in progress? And my second question would be, Malaysia confirmed its first citizen, the first local citizen who is suffering from this. And he mentioned that he came to Singapore for a meeting with his colleagues, one of which is from China, Wuhan. So may we have more details about this meeting that was held in Singapore, and what measures are you taking, our health authorities taking? Thank you.
Okay, I'll take both questions as well. First of all, for cases 22 and 23, these are the 2 individuals who in fact were returnees from Wuhan and evacuated on the 30th of January. They remain asymptomatic without any symptoms at all. In fact, they were only tested because we've introduced a new testing program. We wanted to make sure, in fact, that those who are returning from Wuhan, which is a higher risk setting, given that we know there's community spread in Wuhan itself, we wanted to assess whether or not, in fact, there's a possibility that returning travelers, while currently asymptomatic in quarantine, whether or not, in fact, any of them were also carrying the virus. So testing is occurring in phases, and in fact, in this first phase of testing, 2 of these individuals had positive tests. They are already under quarantine, and in fact, they have remained in quarantine since their return to Singapore. So there's no risk of any spread to any other individual since their return to Singapore. They were originally in quarantine, and now they continue in isolation at NCID. Right, so that's the first aspect. The second question you asked was? Yes, we received word today concerning a new case in Malaysia. I understand the announcements were made in the early afternoon in Malaysia. And in fact, we have got excellent relations with the Malaysian health authorities. We've been cooperating bilaterally when we've had contacts that had traveled across to Malaysia of cases that were confirmed cases in Singapore. That information was freely shared with the Malaysians, and in fact, the Malaysians were very appreciative of this. And in return for this particular case, they have been quite quick as a diagnosis was made to provide us with some information about this particular individual's stay in Singapore. They were providing us with information as it presents, and just as we do our contact tracing, not all information might be available at the first instance. And therefore, we look forward to further information from our colleagues in Malaysia that allows us, therefore, to carry out further contact tracing. But based on the information we have, we understand that that particular risk exposure, in fact, was quite some time ago. And there's a possibility, in fact, that many of the people that were participating in this particular meeting may not even have been, may not be in Singapore anymore. But as we get further information, that will allow us then to carry out specific contact tracing for this particular case, and then further information would be available.
Hi, Phil Hymas from Bloomberg News. Singapore has been very clear about its precautionary measures from the start, particularly with regards to masks and not wearing masks if you are well. At the same time, you have healthy government officials from other countries going on television wearing masks. I wonder if this mixed messaging and mixed measures that exist between different countries, particularly with regard to masks, has had any impact or made it difficult to get your message through to Singaporeans, and if it has perhaps inflamed any sense of panic that may or may not exist here. Thank you.
Thank you for your comment. I think we will have to appreciate that different countries, different governments have different considerations. and their local situation is also vary from country to country. So I think it is probably not appropriate for me to comment on the practices of other countries. But what we want to do locally in Singapore is to focus on helping Singaporeans understand how the masks work for them and when and where they should be using their masks, rather than to wear it when you are well. So I think it's something that the message we have to continue with this public messaging campaign, so that this message can go down. And there's also strong medical and scientific evidence how the mask protects you. So I think we are continuing our effort to educate our Singaporeans to better understand how best to use the mask. Maybe I'll ask Aubeck, who is from Ministry of Manpower, to talk about measures for the workers and workplaces.
Thank you, Minister. Good afternoon, ladies and gentlemen. So, as the Minister has mentioned in his remarks and also in the press release, part of the enhanced measures involve enhancing personal hygiene and environmental cleaning. So I'm here to elaborate on an advisory that the Ministry of Manpower and the tripartite partners will be issuing today. And the intention of this new advisory is to provide guidance on what can be done at workplaces to preserve their cleanliness and ensure that the environment continues to be safe for workers to operate in, and also some guidance on what frontline workers ought to be looking out for and how they can help themselves. So the advisory will be addressed to all employers. It focuses on three aspects: the premises that workers carry out their work, the customers that businesses serve, and also the role that individual workers in each company can do. In terms of premises, we are advising that employers should step up the frequency of cleaning, not just in the traditional areas, but also areas where there is high contact with the public. These would include counters where the public is served. It will include meeting rooms where business visitors are hosted and meetings are held. Secondly, for customers, we think companies can also play a very important role in establishing clear guidance to their frontline workers on what they should do if a customer who is visibly unwell were to turn up, and how they can manage that in a professional and in a seamless way. In particular, we are highlighting that companies should consider that if a customer is visibly unwell, to actually advise the customer to seek medical assistance, seek medical treatment, and also offer other options that do not require the person to be physically served. And lastly, on individual workers, this is not just something which employers can do to keep the workplace clean. There's obviously a very important role that individual workers on their own can play, and this coincides with the general advice we give to every Singaporean, every resident here, as to what they can do to prevent themselves from being more exposed to the infection. This is about personal hygiene. It's about taking good care of their health, also self-monitoring their conditions, whether they have running a temperature or are experiencing respiratory symptoms. So these represent the general measures that we are recommending to all employers, and they are applicable to all workplaces. But apart from these general measures, I should also say that in the preceding weeks, some of our agencies like the Singapore Tourism Board, Land Transport Authority, Maritime Port Authority, Civil Aviation Authority, they have all been reaching out to their respective sectoral businesses and the companies there because they anticipated that the tourism industry, for example, would be more prone and more likely to be exposed to more people that may be carrying the virus. So they have already anticipated and provided early advice to the companies, and this is already currently being implemented. Thank you.
Yeah, maybe the lady at the back.
Hi, my name is Niveda from NHK. I would just like to confirm the wording. When you say Singapore residents, does it mean that they are not Singapore citizens, or are they PRs, or where are they from?
Do we have the details?
Yeah, Singapore resident could be either Singapore citizen or Singapore permanent resident. I don't have further details about the nationality specifically, but that would be the interpretation of the phrase.
We can check and let you know.
And we'll give you further information, yeah.
We'll check and let you know.
Hi, I'm Jun Kiat from Asahi Shimbun. Can I check for case 19, 20, 21, and 24? You mentioned that they have not traveled to China recently, but have they traveled overseas recently to other countries? For example, like case 21, she's an Indonesian, so has she traveled to Indonesia recently? And the second question is, we've been reading a lot of news report that HIV drugs has been used in other countries to treat this virus. So is Singapore considering using it, or have you all tested really? Thanks.
I'll ask Kenneth to talk about the cases, and I'll ask Prof Tan Chor Chuan to talk about the treatment.
Yes, cases 19, 21 have not had recent travel out of Singapore. Right? You've asked also about case 24. Again, similarly, there's no recent travel history out of Singapore.
Yes, in a small number of cases, some of the HIV drugs, lopinavir, ritonavir, are being used here. Yes, for a small number of cases. Yeah. The trials are being done in China and other places, but they're being used here. We need to see the results of the trials to know how effective they are. But the results so far from other studies have looked quite promising. Yes. I don't really know. Perhaps you can give you the information after the press conference. Yeah. Lopinavir and ritonavir, stroke. Yeah.
I think we'll give you the technical name later on.
Hi again. Yeah, so could we just get some more info on the patient who has been discharged? You know, what the progression of his illness was, what drugs were used for him, and an update on the other confirmed cases in Singapore.
Okay. We discharged one patient today. That patient was discharged well. All his symptoms, in fact, had fully resolved, and he's had consecutive tests over 3 days, in fact, where the tests were all negative. So we are quite confident that, in fact, he has no longer got any infection there. This is 1 out of 18. The doctors continue to watch and look after the remaining 17 in the hospital closely. One of the patients is being prepared for the possibility of a discharge over the next few days, but we cannot commit just yet because it's a decision that the doctors will make as they review their patients on a day-to-day basis, and therefore it would be premature for me to say that he would definitely be discharged. There are a number of patients, in fact, who are well, and there are at least 3 of these patients who, in fact, have no symptoms. You already know of 2 of them. They are actually included in today's press statement. And many of them continue to make good progress. There are 5 of the patients who have some oxygen to support their breathing, and this is not surprising in view of the fact that they had pneumonia, and this is basically to support them. None of them are in the ICU. None of them are critically ill at this point in time.
Maybe I ask Wei Li to also talk about measures in our schools.
Okay, thank you, Minister. As a result of these developments, as you have just heard, government will be implementing additional precautionary measures in our schools and in our preschools because they are considered a vulnerable sector. We will implement some social distancing measures for school-going and preschool children. Namely, we will suspend our mass assemblies, we will cancel camps, and we will stagger recesses. So the aim is to circumscribe the intermingling of students by not conducting mass-level learning activities. We will be implementing them from this week, beginning immediately with no mass flag-raising ceremonies. We will also be ring-fencing our schools to keep them safe, our students safe. by instituting visitor management measures, such as taking their temperature before they step into the school. And we will also check their travel history, such as if they have a recent travel history to mainland China, they will not be allowed into our schools to interact with our students. Our schools are familiar with such measures because they have implemented them before to manage the spread of diseases such as H1N1 and, of course, SARS. So they are ready to step up these measures. We will, of course, continue to have an emphasis on personal and social responsibility for all our students, and we will continue to monitor the situation closely with the fellow government agencies to implement further measures should the situation worsen.
Okay, we have time for one last question.
Okay.
Thank you. Mayuko from Nikkei. As you enhance the measures, in the previous press conference there was a mention that the air show will go on, but we understand that part of it is cancelled. Is the show still going on? Is there what is the situation now?
The show is still on. As I mentioned, we have enhanced measures, and if should there be a widespread community transmission, then we will consider additional measures, including social distancing. But as of today, because the transmission is a limited community transmission, the air show will continue to be held, and additional precautions may be introduced for safety reasons to ensure that the visitors are safe.